Quite an introduction, isn't it? So hi, yeah, I'm Paul Hay. So as Mark said in the introduction there, my sort of core occupation is I'm a health and safety manager. I've worked in health and safety for about 25 years now, primarily in construction, facilities management, but I've been lucky enough in the different roles that I've held to be exposed to sort of lots of different environments, lots of different people, which I think has given me a really good rounded perspective of what health and safety means to different people in different industries. The reason I sort of start off with that is because despite the fact that I'm focused on safety and health, mental health really wasn't on my radar at all. If you'd have come to me 5-6 years ago and said, Paul, what do you think about mental health? To be completely honest, I would have been one of these people that would have probably said something a bit like, yeah, I kind of get it, but maybe sometimes people need to, pull their socks up a bit and maybe man up a little bit. And, we're all busy people. We're all juggling many balls at any given time. And some people maybe need to sort of, develop a bit of resilience. I now recognise, of course, that was completely wrong, but that was my genuine kind of thought process at the time. Largely because, as a health and safety manager, our absolute focus in the industries I worked on was keeping people safe. It was about making sure that people went home at the end of the working day in exactly the same way they started it, i.e. avoiding accidents, stopping people falling off things and being hit by things and all that kind of thing. Now, of course, that's absolutely right, but there hasn't necessarily in our industry been the same focus on health, and absolutely mental health wasn't something that we really thought about. So although I hope you take it how it's intended, me admitting to the fact that I was probably a little bit cynical and a bit negative about mental health, I was also lucky enough to attend the very first 2-day mental health first aid course that we ran about 5 or 6 years ago now, I suppose. And probably like many of you guys, I've been on more training courses than I care to remember over the years, some good, some bad, some in between. I can honestly say I don't think I've ever been on a 2-day training program that had such a significant impact on me. I left the training course 2 days later with a completely different attitude, mindset, around what mental health meant to me, what it meant to my colleagues, my family, my friends, etc., etc. And off the back of that, volunteered, put my hand up and asked to be involved in what was our mental health steering group. A bit about my journey. In terms of our journey from a health and safety perspective, as a business, we're involved in all sorts of different things. Many people have never heard of Lendlease. If you don't know what we do, there's a massive project of ours about 5 minutes that way. That big tower being built is a Lendlease project. So that's the kind of stuff we do. We built the Athletes Village for 2012. We're redeveloping large parts of London now, so the Elephant and Castle, Stratford. We've just won the contract to build the Athletes Village with the Commonwealth Games in Birmingham. So that's the kind of stuff we do. An Australian company, global organisation. And we've always had, I guess what you describe as a pathological obsession with health and safety, a pathological obsession with safety, most definitely. But again, we didn't necessarily think about the sort of other areas that maybe impact on people's ability to perform effectively at work. So as you can see on the board there, what we've got basically are kind of 4 different pillars. I will apologise for the typo in case you spotted it. Of course, it shouldn't be heavier minds, it should be healthier minds, so I do apologise for that. It's a bit of clip art that I couldn't alter before the presentation went live, so apologies for that. But our 4 pillars: supporting healthier minds, developing healthier bodies, building healthier places, and creating healthier cultures. To give us an indication of where we were back in 2012, 2013, and this happens every 2 years within our business, we do a wellbeing survey where all of our people globally get asked lots of different questions around their health and wellbeing. It goes way beyond sort of traditional health and safety. And some of the stats that came out of that, for example, we identified that a significant number of our people are dealing with stress at any given time. A lot of our people struggle with fatigue, they don't get enough sleep as a consequence of the role. Things around diet, for example. And there's many reasons for this, and some of which I'll talk about in a moment. But the one that came out top back in the day absolutely was mental health, and that sort of started our journey around this. But what we also did at the time was we looked at our industry and some of the problems that we have in our industry. To give you an idea, in 2017, 2018, there were 38 construction-related deaths. So that's people dying through workplace accidents. At the moment, we're running at about 150 fatalities every year in the UK in workplace accidents, and usually around about a third-ish, give or take, will be construction-related. But what we also established when we started looking at this baseline data was that we are 10 times more likely to experience a suicide on one of our projects than we are to experience a death from a workplace accident. Because the current stats are telling us at the minute around about 400 construction workers take their life every year in the UK. It's very difficult to get accurate figures for all sorts of reasons that I won't kind of bore you with, but it's around about 400 there or thereabouts. Of course, what that equates to pretty much is a construction worker taking their own life every working day of the year. Every working day of the year. Depending what report you read, there are some estimates that say it's a lot higher than that. I did read a report that in 2016, I believe it was, I don't quite know how they worked out exactly, but there were 454 deaths through suicide to construction workers. Now, I don't know if those statistics surprise you, but when we sort of first started interrogating them and looking into them, we were blown away by it. You know, I've spent 20 years of my career focusing on keeping people safe at work, trying to impact on that 38 construction-related deaths. No thought at all around mental health. What that equates to is around 16% of all suicides are construction workers. In case you're wondering what do we mean by a construction worker, it is a pretty broad church, it's fair to say, but it's when someone's got what we call a CRO, a construction-related occupation. It's kind of how we classify a construction worker. That equates to, from a stress perspective, 400,000 days lost. And of course, the question that often gets asked is, why? Why is it such a problem in construction? And for me, it's dead simple. I'm a fairly simple person, guys, because it's full of men. It's a male-dominated industry. It's still around about 85, give or take, to 90% male-dominated across the board, the blue-collar and white-collar workforce. If you look at your blue-collar workforce, so your trades, bricklayers, plumbers, electricians, etc., you're looking around 99% male-dominated. It's a tough industry. It usually involves a lot of long hours, okay? A lot of working away from home. It's quite an old-fashioned industry in its approach to things like well-being. You know, a lot of the guys that work in construction are not only living away from home, they're living in a completely different country. You know, in London, for example, on our particular projects, we have a very, very high number of Eastern European people working on our projects. They're not just working down the road a couple of hours, they're working, you know, several hours away from home, months and months at a time. And of course, and I can say this because I am one, men don't tend to talk about their feelings, their emotions and how they're feeling. And certainly in construction, where if you look at the sort of demographics in terms of age, it's quite an old industry. You know, there's not that many young people coming into it, unfortunately. I think you can very quickly work out why we've got the problem that we've got in construction. So we developed a strategy to deal with this, and it involved sort of, I suppose, loosely kind of three areas, of which I'll talk about what we actually did in a moment. I'm very mindful that the orange light's going to come on in a moment, so I'm trying to whiz through my presentation fairly quickly. We looked at how do we educate people, we looked at how do we support people, and we looked at how do we promote what we're trying to do from a mental health perspective. So when I sat down to write this presentation and started thinking, okay, what does that actually mean? What did we actually do? I came up with a really, really long list of stuff that we've done over the last 5 or 6 years, which I guess helped to contribute to us being awarded the Mind #1 employer for this particular year. So since we started our programme, we've put 450 staff through the 2-day mental health first aid course. One of the questions that I sometimes get asked is how do we know that what we're doing is working? Because of course what people would like us to do is be able to flash up slides with charts and things on there. And one of the problems with the mental health programme is a lot of it is kind of anonymous. A lot of it is done sort of behind the scenes. You know, if people start thinking if they're going to go and speak to a mental health first aider and they're going to appear on a chart somewhere, they're not going to speak to that mental health first aider. So you're straight away going to damage what you're trying to achieve. But anecdotally, and I can speak as an active mental health first aider, you know, I know that myself and many of our colleagues who act as mental health first aiders for a business are getting phone calls and emails and taps on the shoulder regularly to talk about mental health. At any given time, we've got around about 150 what we call active mental health first aiders. So that means people who've been through a training course and they volunteer to be an MHFA. We're very mindful that, you know, some people coming onto the training and either didn't want to be one when they came to the training or actually having done the training decide they don't want to be a mental health first aider, and that's absolutely fine as well. We also provide the awareness session. This is part of the education piece, of course. We include that as part of our induction, so every new starter to Lendlease goes through the half-day mental health first aid training programme, so we set people up for success in that respect. We also tie in with specialist charities. So at the moment, for example, we're working with a charity called SANS. If you've not heard of them, they are a sudden infant death syndrome and neonatal death charity. So what we try and do is give our mental health first aiders specific skills to deal with specific issues. So they go through the 2-day course, but we also then tie them into some of these other charities. BEAT are an eating disorder charity. We're looking at doing some work with Cruise, who are the bereavement charity, and other organisations as we move it forward. We have more health and wellbeing programmes than you can shake the proverbial stick at, it's fair to say. Just a few examples on the board there. Most of these are at the very least subsidised. A significant number of them are completely free to Lendlease employees. So we do mindfulness, yoga, all sorts of health checks, skin cancer, breast cancer, prostate cancer, general kind of BUPA awareness, sleep workshops, you kind of name it, we do it really in terms of providing it for our employees. We're lucky enough to be in a position where we provide our staff with private healthcare insurance through BUPA and also, of course, an employee assistance programme. The reason I mention that is because a lot of our staff utilise the mental health provision provided by BUPA. I think at the moment, we don't get names and numbers, of course, names and detail, of course, but in terms of numbers, the last report I saw, I think we've got about 30 or 40 staff going through professional support provided by BUPA. Flexible working and wellbeing days, we're very kind of heavy on the flexible working. That can be a challenging construction because you can't build something sat behind your kitchen table. But, you know, we can build in flexibility in there. Wellbeing days, so every member of staff is entitled to a minimum of one wellbeing day every quarter. That's on top of an annual leave entitlement. You've not got to take it, it's there should you want to. The idea being it's a day that you spend for yourself. We tie international campaigns, so we are currently launching a construction industry-wide initiative called Building Mental Health. This is a big education piece actually around promoting the training and education to our trades. You know, organisations like Lendlease, we're quite lucky because we've got decent amounts of resources available in terms of training people. We recognise that a significant number of the people that work on construction projects are SMEs or self-employed. They don't have endless amounts of money to throw at these programmes. So this is a largely free educational programme. Time to Change, first construction company to sign the Time to Change pledge. And then there's things like kind of Movember, World Mental Health Day. And then, of course, we also look at external benchmarking. So we've done the Mind Wellbeing Index twice. The first year, a couple of years ago, we were awarded silver. And the reason we do it, okay, it's nice to get a trophy. Who doesn't like going to an awards do, right? But more importantly, it allows us to benchmark what we're doing against other organisations. We achieved silver, and with the silver, we were 2 percentage points off getting gold, which we were a bit upset at the time, but actually it gave us a target. A bit like Glastonbury, we had a fallow year the following year, and then this year we did it again and we got gold, and we're pleased to find out we'd actually been rated #1 out of all of the different employees that took part in that particular index. So it's a really useful exercise for us. Mind provide us with all sorts of support to enable us to get better. So, in fact, we've got a meeting with our account manager next week to talk about some of the improvements and some of the things we can do to take it forward next year, etc., etc. In terms of our staff engaged with what we're doing from a wellbeing perspective, the last figure shows that 72% of our workforce participate with some kind of wellbeing initiative. Importantly, nearly half of those are male. Now, the reason I put that up there is because when we first started doing a lot of this, very few men engaged with it because they thought it was a bit fluffy and a bit soft and all that kind of stuff. Whereas now we're seeing an increase where more and more men are participating with our programmes. We also, where practical, open up to our supply chain. So 19% of our programmes were delivered to our supply chain. And nearly half of all customers, if you like, were from our construction business, which again is a massive upturn because that didn't used to be the way. One, I suppose, quite sobering point to leave you with, I guess, is that in that particular period, as part of the health and wellbeing checks that we do, we had 29 cancer referrals. That's 29 people who had undetected cases of breast cancer, prostate cancer, and skin cancer. There's one story of one individual, one female colleague, who went to the doctor. She'd identified a lump in her breast. She went to a doctor. Doctor said, nothing to worry about, it's absolutely fine. She thought, well, I'll go and do a Lendlease check, you know, just to be sure. The nurse that did the check was a little bit worried and referred her, and she was found to have type 2 cancer. She's had to have a double mastectomy, but she's still with us, and that's the important thing. You know, and how do you put a figure on that? That there are potentially 29 of our colleagues walking around because of what we do as a business. In terms of what we've learned, for me, guys, it really is about getting the conversation going, specifically around mental health. The key point being here is stigma still exists, massively exists, certainly in our industry, but the more you get the conversation going, the more you reduce the stigma, and the more you reduce the stigma, the more you get the conversation going. And it becomes this kind of endless cycle of where you get to a point of what we hope will be normalising the conversation, where we all talk about our mental health in exactly the same way we talk about our physical health. I've had to whiz through those last couple of slides. I did the same presentation last week. It took 45 minutes. So I really apologise. I'm getting sort of people waving at me from the back of the room. But look, that's the presentation. I believe there's an opportunity now for a couple of questions. Maybe one question.